Welcome to Bostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Well, hey, everybody. Welcome to another episode of Bostic Health. I am Bradley Bostic, your host, and I have a great guest today, Jim Wallace. We're here to talk about a couple of things, in particular around how value-based care is something that we all need more than ever in healthcare, but we have a lot of room for improvement, and how AI can help solve that through personalized healthcare. I also am excited to be at least among the first to announce his new book. He is the author of Precision Medicine, AI, and the Science of Personalized Healthcare, which is coming out in the coming weeks. So definitely pick up a copy of that. And then also just worth mentioning, he serves as a senior researcher at Harvard Business School. And in addition to being just an all-around great guy, he's an entrepreneurial leader who has worked quite a bit with me on our business Decision RX, which is working on solving this problem of getting people on the optimal personalized medications, which, as it turns out, makes people a lot healthier. Jim, welcome to Bostic Health.
Thanks, Brad. It's always good to see you. I think you mentioned before that this is the podcast 35, episode 35. Is that right?
Yep, this is episode 35. Thank you for pointing that out.
I think it's also my hesitate to say this, but my 35th year in healthcare.
Okay,
yeah,
awesome.
which dates me, but that's also that's what we plowed into the book.
Well, I remember when Lovers introduced us initially. I think
Yes.
that's how we met.
Yeah.
And you guys had worked together in the payer world a long time ago.
Yes.
And you were lamenting the fact that the concepts you were discussing 25 years ago still hadn't been implemented fully yet, which is pretty hard to believe.
Yes, no, and without sounding too gratuitous, I remember Mark saying, "You got to meet these guys. They're the smartest guys in the world." He said anybody's going to finally break through what we were talking about 30 years ago, it's going to be Brad and Travis and your crews. Yeah, it's always good to reconnect with you. And I'm happy to talk.
I love the kind words, and I love the fact that we are actually making meaningful change together in healthcare. There's a lot of people that are talking about what needs to change. Not enough of us are actually out there making it happen. And yes, I'm proud to say that you and I are a couple of those folks who are doing it. So maybe before we dive into the content here, give your own introduction. We'd love to hear a little bit more about what got you into healthcare to begin with, what you're up to now, and where you're really heading in the future.
Sure. Well, I started years ago. I was a combat pilot in the Army when the world was a much safer place. I flew helicopters in the Army back when things were a little bit calmer, but decided to get out of the Army, and I went back to get my MBA at Harvard, and then took a role with Bain and Company, the consulting firm. Very quickly after that, I joined forces with Mark Lubbers and Ben Lytle in Indianapolis at Anthem as the head of strategy. Ended up spending a few years there running a couple of their operations before launching out on our own and creating a company, TWG Capital, which then funded innovations in healthcare. After selling that company, after about a dozen years, I had the tremendous opportunity, quite randomly. That's an interesting story for another episode.
No, I love this story. You have to tell the story. It had something to do with driving your motorcycle across the country, didn't it?
Yes, I bought a motorcycle after we sold the company with the sole intention of driving to the Pacific Ocean and just dipping the front wheel into the Pacific Ocean. And while I was out there, my son Zach, who's a graduate of Purdue Aerospace, said, "Dad, you got to look up this company, SpaceX." And so I did, and it turned out they were having some issues selling rocket launches internationally, and still early stage for the company. And so I called the company, got an interview, and next thing I know, I was on a plane to Germany selling rocket launches. So I went from the beach at Santa Barbara to an airplane with Elon and the crew. So that was fantastic time to be involved with the company. Turns out the rockets sold themselves, and all the people that were selling rockets with us at the time, I think we had built a manifest of about 52 launches. Didn't need to sell anymore. The rockets sold themselves. So I ended up coming back to healthcare, running an operation with AmeriLife Group, their network operations, a nationwide PPO, which was about 1,400 primary ring hospitals, about 65,000 physicians. And that's, I was there until I joined forces with you and Travis on a couple of other endeavors. So that's my background in a nutshell. Suffice it to say that I've probably seen a lot of failures across healthcare in my time, and I can recognize a winner when I see them. So I'm glad to be here.
Awesome. Great having you on. And my understanding of the inspiration to create your book, Precision Medicine, AI, and the Science of Personalized Healthcare, it was very much because of the fact that we've seen this need for decades to shift healthcare to a model that is more oriented toward preventing disease and helping people get better faster. And historically, though, it really wasn't very feasible because it took so much human capital. It took so many hours of people's time. But now we have this emergence of AI, and it seems like it might give us this chance to actually realize that vision of more personalized care. Is that what went into really getting you out there to write this book?
Yes, that's exactly right. The care community is inundated with information. There's no lack of information. You know this as the chairman and founder of C1 and 3Aware and DecisionRx. The the issue is, what do you do with it? How do you separate the signal from the noise? Well, there's two really deep sources of information that kind of complicate that's wearables technology and genomics, which radically get us in front of healthcare issues. But now AI and big data come along and allow us to synthesize that in ways that humans just can't possibly do. Now, the occasional genius healthcare provider might be able to intuitively put that information together and make leaps of care plans and treatments, but we really need to focus more on those outcomes and less on the cash register ticket punching of episodic care. And that's what AI does. AI allows us, when it's correctly deployed, to synthesize a lot more data that turns us from episodic care into longitudinal care. And once we make that turn, as I kind of make the case in the book, those four drivers, wearables, genomics, big data, and AI, allow us to really become longitudinal care partners, the patients, the providers, and the payers, in a way that we just haven't seen so far. Create some challenges for the investment community to kind of figure out the winners from the losers, but that's kind of where we are and where I lead the readers in the book.
Got it. So, are there some examples that you've seen today where this type of AI is being deployed and actually driving that meaningful change? And then also, I would ask, when you see that meaningful change happening, how do you think the economic models need to shift in order to fund all of this? Because if you have to wait to prove that everything's worked and how much it worked and how much it saved, that creates a pretty massive cash flow challenge for folks
Yes.
that are trying to do value-based care.
Yes, that's a great way to look at it and think about it. I think I would answer those questions in the reverse order. I think most of the I just finished this analysis for another endeavor related to the book, but most of the investment right now in terms of raw dollars is going into those things that compartmentalize costs. They're going into payments and financing and reporting and compliance, because that's where the payers have the most invested, and it's the easiest kind of low hanging fruit. But that doesn't directly relate to outcomes. What really relates to outcomes are, I mean, frankly, a lot of the businesses that you're invested in. It's going to be the diagnostics that give way to predictive insights and assembly of real world evidence and genomic data. I think I just hit HC1, 3Aware, and DecisionRx would be three companies I refer to in the book. Those are the places where the investment community needs to flex. But where, in terms of examples where that's already occurring, I can think of several. Wearables is a little bit different because it's consumer tech, and I think Apple's going to see a comeuppance in the next 5 or so years, because they're really very invested in a very complicated technology. They're invested in something that's very complex and difficult to navigate when you just want information on the fly. That's the smartphone. Wearables technology delivers way too much data, and nobody has really figured out how to synthesize that and draw insights, I think. And that's solvable by a $400 consult. So if you're a provider and you're not paying for that, you're violating your Hippocratic oath. And I hate to be so dramatic about it, but that's one example. Arene is another example in the same space that does analytics without the testing, but delivers an analytic answer that says, hey, you probably need to focus on these patients because they're high polypharmacy. From there, you can look at Tempus AI, who's doing this. Eric Lefkowski and his team at Tempus AI are doing it within cancer, but then now are extending it into cardiovascular and the other top 4 categories inside non-communicable diseases. When you move to the big data layer and the AI layer, I don't think anybody really has a lead on it right now. Epic clearly and Cerner have now Oracle have kind of the lead in installed base, but they don't have, to be candid, a clue about how you translate data flow into actionable insights. The up and comers in there are going to be firms like Arcadia and Innovator or Persivia, who are taking that data. I just met with one of the firms this week or last week about this. They looked at their diabetic population and determined that 63% of them had a behavioral health comorbidity, that when you treated that comorbidity, the diabetic complications radically subsided. Well, that's something you would never get when you're just pumping insulin care through insulin related care through there. So it went a long time there, but there's a lot of examples in each of those 4 categories.
Yeah, that's very interesting. And when I look at that stat, about 16% of healthcare expenditures are driven by medication failures, it's hard for most people to relate to that unless they or a loved one has the kind of complicated health conditions where they're on 10, 12, 14 different medications. And when you're healthy and the kind of working age that we are, you don't necessarily realize that there are so many ways that that can harm the patient and actually result in them having the ER visit that was unnecessary otherwise, or falling and having some type of a hip that's broken, or all of these costs that relate to medications that aren't prescribed correctly. And as you mentioned, with DecisionRx and other players are getting into this mix, we use a combination of every single vector that has been studied about how medications can affect you, good or bad. And that includes the layer of pharmacogenetics, which is a genomic test that's specific to pharmacology. So it's not getting into ancestry level information or anything
Right.
like that. It's just saying, hey, these are the known issues between your specific genes and the medications that you're taking or you could be taking. And as you pointed out, the combination of the test and the consult maybe is in the hundreds of dollars in order to get this right. And if you save one hospital visit, you save thousands of dollars. We're seeing in our case with DecisionRx, you save about $3,500 per year
Yes.
for every time you optimize somebody's medications. And we're talking about people who are high risk, but that's a significant portion of the population. But that's just like a very small view into what's possible.
Yes.
It is really across any type of disease state or any type of health condition that these kinds of things can be done. Another one that Jim, I don't know that you and I have talked about, that HC1 is employing, and I'm really not conveying these examples to be self-serving. It's more just because this is my firsthand experience of seeing the rubber actually meet the road. Within HC1, we acquired a company called Acumen last year, which is really a phenomenal, talented team in the diagnostic space that understands better than anybody I had seen how to optimize the way the lab is informing all kinds of things in healthcare. And come to find, one of the major areas that lab addresses is blood management.
Right.
And when you have somebody come in for a surgery who has not been proactively tested in advance, lo and behold, a significant percentage of the time, they are anemic when they show up for
Mm-hmm.
surgery.
Mm-hmm.
And if you show up for surgery and everything's all ready to go, the surgeon's there, the OR's ready, you're not going to go reschedule to try to give this person an infusion to try to get them boosted so that they don't have anemia. You're just going to give them a blood transfusion.
Mm-hmm.
And as it turns out, a blood transfusion is a very risky thing. It's like a liquid organ transplant. It's not
Mm-hmm.
just like giving somebody saline.
Mm-hmm.
And so one of the solutions that these brilliant folks that are delivering more personalized care on the HC1 team have created and have deployed now successfully is this solution that's focused specifically on anemia. But anemia is just one gap in care. There are loads of them. all the way to the other end of the extreme with rare disease or certain cancers. Like if you have non-small cell lung cancer with
Mm-hmm.
a specific genetic mutation, certain biomarkers, there are actually some pretty miraculous treatments for that. But if the physician doesn't know about that diagnostic test, or they're not able to interpret that detailed biomarker on page 66 of a next generation sequencing report, unfortunately, that patient's going to miss out on that care opportunity. And that is a gap in care. And so it's
Yes.
everything from the day to day fixing anemia all the way to identifying rare disease and connecting it to close that gap in care. AI is so well positioned to fix that whole range of problems.
Yes.
And even before you get into the details of how that helps economically, imagine what that does for our parents or for us or our friends and family members as you look at the future of healthcare and how you can ensure that you're getting the best possible care. So I'm thrilled that you're writing about this, Jim. And
Yes.
also, thanks for highlighting the innovations that we've created in our companies. It's pretty
Yeah,
awesome.
well, I think a lot of my learning came from the exposure to the situations that you just illustrated. I think both in our personal interaction, but then broadly, when I set out to kind of synthesize the learning in the book, I wrote it strictly as a scientist. I mean, I'm an applied math guy. I don't write books for a living. When I first delivered the first draft, the publisher at Wiley came back and said, you got to make this real for people. And so I went back and looked at actual situations like you described, and added a chapter in each of the 4 sections of the book, distinctly profiling a particular individual with a particular condition that typically is in that 80% of non-communicable diseases that affect almost everybody, and then really driving it home to, this is what's available to you today. This is what you can do. There's a section in each of the chapters that says, this is what you can do today to ask your doctor about availing yourself of things like this. It was a really an eye-opening experience for me. I know you have a personal experience with a healthcare system, and I think your mother's situation. I do as well with my parents. They're past now, but they both experienced kind of hiccups in the healthcare system that you look at afterwards. And you're like, gosh, if we'd only known that, they could be they could still be with us today. And I get choked up every time I think about it. But that's what really compelled me to write the book, is that there are things that are out there and available today that AI is accelerating at ways Alvin Toffler, when he wrote Future Shock back in the 70s, anticipated. And he said, there will be a point in time where we're delivering information at such a pace that humans can't keep up with it. Well, AI takes us to that next level to say, I illustrate in the book, hey, you need to think about this, because if you're a 50-year-old woman and you have pain management and your occupation has you standing on your feet all day, it's probably not because of something in your health makeup. It's probably something environmental. And here's the big data that will show us what to do about it. Just
Yeah.
things across the spectrum of healthcare that are really changing how we can treat people and get in front of opportunities in the way that we haven't in the past.
That brings up to me, Jim, the fact also that when we talk about healthcare and we talk about somebody's health journey and how we all want to be as healthy as possible, a lot of what people identify as an obvious, commonly accepted approach is diet and exercise.
Yep.
And it's hard to do diet and exercise really well, especially in a culture that's set up for you to be sedentary. And it's one of the reasons I love being in the city, or
Mm-hmm.
I'm currently out actually working from Telluride, where you just walk everywhere. And, that to me is part of what the kind of communities I like to be involved with.
The
And it's not
maximum
just,
of healthiness in
yeah,
Telluride, right?
it just
Yeah.
makes you feel good. Right. And it's a powerful thing to practice, but it's difficult. But there's this huge divide between what I would call either functional medicine, or now people are increasingly just referring to it as longevity, and conventional traditional healthcare. And I think, you're hitting it with respect to like wearables, where there are certain aspects to what you're tracking that would be considered by your traditional Western medicine physician as helpful, as like sort of an input. But there are other things where they'd say, that's who knows whether or not that's actually helpful.
Hmm.
And one example I'll give, you brought up just how the Apple Watch and the whole Apple ecosystem as it relates to health tracking, it's a pretty high overhead, complex situation in order to track this information. I wear a Whoop band, and one of the things I love about this Whoop band, my friend David Duran, who's the founder of Greenlight Guru. It's a really cool med device tech company out of Indiana. I actually need to circle up with David. I haven't talked to him in a while, but he recommended the Whoop band to me years ago when it was a brand new thing.
Hmm.
And what I loved, candidly, is that it was very focused on doing a thing really well, which was monitoring my biometrics at the highest possible sensitivity with the best sensors in a way that had the longest battery life, and that there is no screen at all on this thing, which helps extend the battery life and eliminates another distraction I don't need. And I go round and round with people about this, but I mean, most people think their focus and their productivity get eroded by having additional things that are alerting them or distracting them.
Right.
And to me, that's not ideal. I hate it when I'm in a meeting with somebody and they keep looking at their Apple Watch. I'm like, what in the, fuck is going
Right.
on? Like, we're
Yeah.
in the middle of an important conversation and you
Yes.
keep looking at your Apple Watch. And
Yes.
on top of it, you can't really use it to track your sleep because it has to be charged all night long.
Yes. Yes.
And so you have to take it off anyway. With a Whoop band, and I'm going to get to a more important point, but with the Whoop band now, the latest version, it lasts 14 days. The
Wow.
battery does.
Wow.
And when you charge it, you just slide this little battery pack on top of it when you go to bed, and it charges,
Charges by itself while you're
yeah,
sleeping.
exactly.
Wow.
Charges by itself while you're sleeping. But the thing that's actually been the most impactful with the Whoop band is I created a Whoop team that is a series of people. It's probably like a dozen of us now all across the country that all have Whoop bands. And every day you can see who's the leader in recovery, who's the
Wow.
leader in strain,
Yep.
and what's going on. And it leads to actually a community of people that are all sort of together rallied to do certain things. And now I will also mention one of the things you get the most credibility for is when you have a 1% recovery, because it means you had a hell of a night. But in any event, it's a really cool construct. And I think there isn't enough emphasis placed on just the power of community
Yes.
and wellness. And I think you touch on some of that, right? Like, where it's about this bigger
Oh yeah.
picture, not just, oh, I feel sick, I've got this specific symptom, I'm going to get tested for that thing and then have some medication and some therapy. And then ideally I get better from it. And then I wait for something else to go wrong. I mean, there's a reason you take your helicopter in your military example, and continuously have maintenance on it and before
Yeah.
the thing breaks, because it's going
Yes.
to fall from the sky. So
No,
anyway,
you're
that's
you're
an interesting topic.
you're so far ahead of most of our industry in that respect. That was my doctoral work was actually on the social determinants of health that kind of reinforce our health. And you're exactly right. I just returned from Paris where I was speaking on this specific topic. 37% of healthcare variation is related to your social support system that exists outside of your physician patient relationship. So, exactly what you just described, and we talk about this in the book in the first section on wearables, is related to how you interact with your wearables and how your social support system interacts with that. And Whoop is featured in the book. It's leading in that clearly. But you touch on something super important that's different for every single person. And what we've suffered from for so long is what traditional medicine relies on is medicine of the averages. I just had an exchange on LinkedIn with Eric Topol, the physician, and Artem Petapushian, who's the Nobel laureate who discovered the proprioceptive gene that tells us lets us know where our muscle movement is in relation to our body. They are promoting this analysis that shows how many steps lead to optimal health. But the problem is the band around that is so broad that it could be seven. So the average, the magical answer for everybody that's listening is 7,000 steps a day. But the band around that, just for the 95% confidence level, is so high, so large that could be 3,000 steps for somebody as healthy as you, or 20,000 steps for somebody that needs to, tighten ship a little bit. Does that make sense? I mean, it's phenomenal how much information is out there and yet is not really absorbed in the care treatment plan. You're two people, same diagnosis, could have completely different care treatment plans, but they typically don't get that in today's healthcare environment, value-based care, because it's medicine of the averages. The summary comment in the book is we need to pay more attention to those precise differences in our biology that make that 1% recovery not such a big deal for you, where it might be a big deal for me. Now, I did make it to Everest Base Camp a couple of years ago, so I'm not over the hill yet. No pun intended. Yeah, you're way ahead in terms of interpreting kind of applications of this. I'm hoping that companies like Apple can really see their way out of this kind of proprietary ecosystem into more of an open source system like OpenAI, but I'm not counting on it. There's a
No,
lot of
well, hey, let me tell you something that just happened, and you may have seen this announcement that I just was absolutely euphoric about. The announcement that Alice L. Walton School of Medicine is opening. Have you read about this?
I've heard it. I'm not super
Okay.
familiar with it.
I'm going to read this from a Time article, and it's informed by her own experiences with healthcare. She's like, this is broken. And it was about the fact that it was totally siloed on the sort of traditional clinical versus more the wellness and preventative. So they say in this article, let me see here. And let's see. The school will train students over the next 4 years in a radically different way from the method most traditional medical schools use. And that's the point. Instead of drilling young physicians to chase symptom after symptom and perform test after test, Alice Walton wants her school's graduates to keep patients healthy by practicing something that most doctors today don't prioritize: preventive medicine and whole health principles, which involve caring for and not just treating the entire person and all of the factors from their mental health to their living conditions and lifestyle choices that contribute to well-being. Wow. There's a whole medical school now funded by, in part, the the wealthiest woman in the world, who comes from this incredibly entrepreneurial family that has a history of knowing how to win. And I suspect that this is going to be a winner. And I would predict that if you fast forward 10 years, the medical schools that are not embracing this kind of approach will be dinosaurs, because we'll look at them and we'll laugh and say, neat, you guys can make it so we wait until people get sick and then diagnose them then when they're already sick. And, that's just not the right way to be. With AI, you can identify these signals so much more proactively. So I think the timing of your book and this kind of work that you're doing, and frankly, we're doing in this community of more progressive innovators in healthcare, which is what this podcast is all about, I think the time is now.
Yeah, no, you're exactly right. We've been here before too. One of the chapters in the book, each section has a kind of where have we come from humorous look at something as ancient as bloodletting or drinking camel's milk to radium salts. Back in 1910, there was something Abraham Flexner did publish the Flexner Report, which was kind of what you just described that's necessary today. He was commissioned to look at the medical school curriculum and say, this is what's working and this is what isn't. It's kind of funny to read that now, and I detail that in the book, but we need the Flexner Report again. We need something like the Walton School of Medicine to say, hey, delivering episodic medicine is helpful, but we're now on to stage 2 or version 2.0 or 3.0 of healthcare. And I think that I agree with you. If I were to predict 2 or 3 years out, well, one example, Travis, your partner and I did an analysis, and I think the typical med school curriculum features one semester of pharmacogenomic training, and yet 53% of all medications are not metabolizable by the patient. And so that's clearly something that needs to change when you start looking at the whole person. So I'm super excited about that. And that's, again, the thing that compelled me to write the book was just to kind of stop and say, hey, what kind of fragile, brittle things are we doing, to borrow from Nassim Taleb, that we really need to make more robust and invest more in? And there exactly where I think your head is. It's on the diagnostic and the predictive, and less on the, what was my attribution rate last quarter for my ACO, or
Right.
what's my benchmark rate for next year with or without these HCC upgrades. That's the wrong way to look at it. The right way to look at it is, how do I make, Mr. Wallace better, because the costs are going to come down if I make him healthier. So lots of things on the horizon. I actually, the final chapter in the book, I predict what primary care is going to look like in that same 5-year period. I think we're going to move from this gatekeeper mentality to more of a longitudinal bifurcation, which is going to focus on people who primary clinicians who are good at predicting, and primary care physicians who are good at acting at inception. And once you predict and head something off, you deal with half the problems. Once it's occurred and you deal with it at inception and hand it off to a chronicist, a geriatric physician, healthcare starts to look radically different. What does that mean, though? It means a lot more primary care docs need to be in the system, and they need to learn more to expand their top of license. Really exciting times. And precisionmedicinethebook.com, I go into that at the kind of the top level, but there's a lot of things happening that are going to change how we live longer and be healthier.
Yeah, well, I think I relate it to the Seurat artwork where you have all
Oh
these
yeah.
points, and if you just see like a little bit of a few of those points, it just looks like this random pattern. But if you zoom out, you see this total picture, and it tells you something. It gives you such a more detailed set of information. And I'd say the same thing exists with your health. It's you have this all these different factors, all these different signals, and like you said, wearables, more traditional healthcare. None of this is to say that you shouldn't go to the doctor and have a normal physical just because you're wearing a wearable. In fact, it says you should absolutely do that. And you should integrate all these other more advanced approaches to being healthier with your diet and exercise, which can include supplementing. I mean, I know for me personally, I am a big advocate for functional medicine, which to me just means really looking at a hyper detailed level at what's going to be best for your body and your health. And I feel great every day. And I think that has something to do with it. I mean, part of it is you do have to be blessed with good genetics. And I feel like that's something I'm lucky to have been blessed with. But aside from that, no matter what your genetics are, if you're proactive about this really detailed level of caring for yourself, including your diet, exercise, supplementing, and you combine that with more conventional medicine, and you combine it with the kind of communities that make you healthy and happy, and personally and professionally you're engaged. And I'm detailing this panacea, which, hey, everybody has their challenging days. There is no perfect. Stress is a thing, but I think when managed the right way and using the kind of signals that AI can identify, you can really take things to the next level. I mean, I'll use another example that you reference in your book about our company, 3Aware,
Mhm.
which Health Cloud Capital formed and I co-founded. Really, 3Aware zeroed in on this challenge of medical devices are used extensively across healthcare. And the question about what the best, highest quality device is and what kind of outcome that will drive, that's one that's been very opaque and difficult to answer. And so with 3Aware, we've created this ability to identify real world evidence from medical records and supply chain data that tells you exactly what devices are used and link those to the kind of quality of the outcome, and also to help the actual medical device companies innovate more efficiently and faster so you can create better care and better outcomes for patients. And it's really exciting to see the kind of adoption that company has had by the who's who, the Medtronics, the Boston Scientifics, the kind of big players in that space are saying, hey, this is a key aspect to the future of the way we're going to do business. And guess what? It is not possible without AI. And
Yes.
so I think that's an exciting example as well. You combine diagnosing people, preventing issues, helping people better manage their care holistically with these signaling and quality measurement capabilities that no human could have ever done. The future is really bright, Jim. I'm excited about it.
Yeah, no, I would probably summarize with this thought. The current healthcare system, and it doesn't matter if I'm in Europe looking at nationalized healthcare systems, or I'm here in the States looking at more of a capitalistic driven healthcare system. Every healthcare system to date tends to look at an issue as a cost. But that's really the wrong way to look at it. Information is ultimately an asset. And you know this with HC1 and with ThreeAware. Once you know something and its predictive power, that is an asset. It's an asset to the patient because it can help them avoid a condition. It's an asset to a provider who's going to essentially or eventually have to treat that. And it's an asset to the payer who can avoid it and make savings. That's all crystallized in the Decision RX, Carlisle model of funding it for funding Decision RX services for free, essentially to the payer. But that's an enormous shift just to get over the fact that, hey, the fact that this person has an issue is a cost to be avoided. No, it's a savings to be harvested just by getting them to do the right thing and engaging them in their care is something that we need to turn the corner on. And the only way we can get there is, as you say, is with AI integrating all those sources of data and then flagging the signal from the noise and saying, hey, doctor, they can't metabolize lisinopril, so don't prescribe it to them. If you do, they're going to the hospital. If they don't, they're going to be better. The future's super bright. I'm super excited about it. And again, I can't wait to see what the next 5 years bring. Whether I'm on a motorcycle or in Telluride or wherever, it's going to be super different from where it is today, right?
Yeah, absolutely, Jim. Well, I have really enjoyed this conversation. I love the abundance mentality and also the proactive work that you're doing to actually get your thoughts and the experiences and thoughts and innovations of others out there in the world. There's a lot of this out there that just hasn't been promoted or recognized yet. And that's the whole point of the Boombastic Health show. And I really appreciate you being part of the Boombastic Health community. Appreciate all the great things you're doing for healthcare overall and also your partnership specifically with Decision RX. It's a pleasure to work with you, my friend.
Awesome. Well, thank you so much. Again, precisionmedicinethebook.com. It's released in September, but pre-orders are today, and read all about it and look forward to the future. So thanks again for having me.
Okay, so put a fine point on that. Precisionmedicinethebook.com is where you can pre-order the book.
Yep, that's the website. It's available on Amazon. The title's too long to really make it catchy, but
I love it.
precisionmedicinethebook.com will get you there.
Awesome. Good deal. Everybody check it out. And hey, thank you all of you for being part of the Boombastic Health community. Thanks for joining us for episode 35, where we've highlighted the great work that Jim Wallace is doing in driving forward the application of AI in healthcare to make it more personalized and better for all of us. Have a great day. We'll see you next Tuesday. Take care.